guideline-directed care for sickle cell disease includes opioids for either acute pain or chronic pain that can't really be managed any other way. Now, the utilization of these opioids is something we really haven't known much about until right about now. So I'm here to talk to Dr. Samir Ballas, Samir K. Ballas, who is an MD and an emeritus professor of medicine and pediatrics at Thomas Jefferson University. Now, when you first set out to do this study, what questions did you have specifically that you thought we needed answers to?
We wanted to answer and clarify that the use of opioids by patients with sickle cell disease has nothing to do with the opioid epidemic. Utilization of opioids in sickle cell patients is needed to treat their pain, and they are not part of the opioid epidemic. Unfortunately, there is a general conception, patients with sickle cell disease take a lot of opioids, they are part of the opioid epidemic. In a way, they are innocent victims of the opioid epidemic.
Correct. So how did you conduct this study?
This was, a retrospective study based on the claims, and we divided the claims into commercial claims about patients with sickle cell disease, how many days they were in the hospital, how many crises they had, how many times they were in the emergency room, and how much opioids they took. And in this study, it's something unique we did. Usually in studies like that, you compare sickle patients to non-sickle patients. But here we compared sickle patients to sickle patients. We compared the sickle patients who are on Medicaid compared to patients who are on commercial,
Okay.
And there was important differences between the two. Yeah.
So you had the commercial and the Medicaid cohorts, so what did you find?
We found a number of things. First thing we found that the age of patients of the Medicaid group are significantly lower than on the commercial group. The average age was 17 years. In the commercial group, the average age was 27 years. So that's one difference. Another difference we found the number of days in which opioids are supplied to patients are much higher in the Medicaid than in the commercial group. The number of crises were higher in the Medicaid than in the commercial group, and so on. There were really significant differences.
Now, you did have about 50% females in both
Female,
groups, so
yeah.
a really good representation, you think, of the...
Yeah, this is one thing. Unlike other, like if you take disease like fibromyalgia, most of the patients are women. In sickle cell disease, across the board, the complications they are more or less well divided between males and females.
Now, the consistency in the proportion of patients and the use over time, I think, was encouraging. I mean, that was what you mainly found. Over time, this has been very consistent.
Very consistent. That was the most important aspect of the study, that it was consistent. So there was no increase in opioid utilization.
Unlike in the general population, where you are indeed seeing this quite a skyward climb in opioid use.
In the general population, definitely there is an epidemic with increased use. Not only increased use, but increased mortality due to opioids also.
Now, in terms of, there were a greater number of days supplied and opioid claims per patient seen across all Medicaid age groups. Well, what are your takeaways from these inconsistencies that you're seeing between these groups? What lessons do you think there are to be learned?
A number of lessons. We are not sure. We need more study to know exactly what's going on.
But your best hypothesis.
They are more sick, and therefore they go more often to the emergency department. Or maybe, when they go to the emergency room and the treatment, they are not well treated, they are undertreated, maybe undertreated, and therefore they are discharged before adequate treatment, and therefore they keep coming back again. So the coming back again could be due to severe disease, could be inadequate treatment. It could be a payer issue. Maybe the payer doesn't pay enough for the opioid prescribed. They give them smaller amount, and therefore they come again. So there are a number of possibilities.
Now, you also saw in this population the significant increase, kind of dramatically, when patients with SCD are transitioned to adult care.
Yeah, this is a big problem in sickle cell patients. Patients, when they are as pediatrics, taken care of by pediatric hematologist or pediatrician, they do very well. They do very well for many reasons. First, they are kids. They have their parents with them. They, take care of them, and the pediatrician do a good job. But once they become adults, usually around the age 18 to 20, then these factors are lost. Then they become adults, they don't listen to their parents, they want to do their own way. So there are a number of factors. It could be maybe in the beginning we thought the adult providers really are not interested in the patient and don't take good care of them. But this turns out to be not really true, because some of it is the patients themselves. They are not, compliant, they do not adhere they don't follow instructions. So it is a multifactorial factor. Not only the providers, but the patients themselves also. And then the coverage sometimes. Some patients don't have coverage when they are adults on their own. They are unemployed and not well educated, some of them, So this is a very complex issue.
And they may have complications based on their age, how long they've had sickle cell disease.
That's also true. Some of them have more complications actually there are some complications become apparent in adulthood more than in childhood.
So in the clinical management of these patients with sickle cell disease, what are the take-home messages regarding opioid use?
The take-home message that opioids are the best good analgesics. They are the best, and they are the best medications available to treat sickle cell pain. The home message that the patients are doing okay, they are not abusing it. The home message is to continue treating them opioid carefully. You have to monitor their use and do urine drug testing, make sure they follow instructions, until we find another new analgesic.
Exactly.
In the meantime, we have no choice but to really to give them opioids. And we have, there is some of the pain societies have it very well written. Say optimize management, but at the same time, you have to monitor the patients to make sure that they are following, they are taking the drugs. You do urine drug testing to check in the urine if they are taking what you are giving. So if it is done like that, I think that until we have something new,
Well, it's got to be good news that as the general public has a problem and that's getting worse, the consistency of opioid use in sickle cell disease is encouraging.
That's the main purpose of the study, is to show that the use, if any physician sees a patient with sickle cell disease, they should realize that these not potential abusers, but potentially they will respond to opioids. But you have to monitor. You have to monitor the use of opioids.
Well, thank you very much for chatting with us. I really do appreciate it. And for ASH Clinical News, please look around. Dr. Ballas is being joined by a variety of different guests here at ASH 2017. I'm Rick McGuire.